Imagine being at the mercy of a heavy period, month after month, then bleeding in between those heavy periods. Or think about having to pee frequently because of constant pressure on your bladder. Some of us are just imagining the agony of these scenarios. Others know the reality of them because they're living with uterine fibroids. Up to 80% of women will develop fibroids by the time they reach 50. Fibroids, also known as leiomyomas, are growths that form in the uterus. They're made up of muscle and connective tissue from the uterine wall. Fortunately, they're not usually cancerous. Another thing to keep in mind, having fibroids doesn't increase the chances of getting other forms of uterine cancer. Many women aren't even aware that they have fibroids because they're small and don't cause any problems. However, larger ones can cause excessive or painful bleeding during periods or between periods, fullness or bloating in the lower abdomen, frequent urination, pain during sex, low back pain, constipation, inability to pee or empty the bladder. Fibroids can grow inside or outside of the uterus and in the uterine wall. While they can be as small as a pebble or as large as a watermelon, having them doesn't mean that it's impossible to get pregnant. However, they can increase in size during pregnancy. Large fibroids keep a baby from being able to flip into the correct fetal position. This increases the risk of a breech birth. In very rare cases, fibroids could put you at higher risk for a preterm or C-section delivery. Because of these risks, your healthcare provider will monitor them throughout your pregnancy. Fibroids have been linked to infertility, although it's hard to pinpoint why. But it's possible to get pregnant after fibroids are treated. While we don't know what causes fibroids, some risk factors can increase your chances of getting them. They include a higher body weight, family history of fibroids, not having children, starting a period at a young age, starting menopause at a later age. If you're living with uterine fibroids, there is help. Your healthcare provider can review the options with you and create a treatment plan based on your overall goals. Fibroids are treated with birth control pills, IUDs, and over-the-counter medication. They can also be treated surgically or removed with use of alternative methods such as uterine artery embolization and MRI-guided ultrasound-focused or radiofrequency ablation.